these other pharmacy chains whom we will not name here, and how you've created such an experience that the person checking for online symptoms, which is what most of us do first, is coming and purchasing either online or offline from you.
India is a country of 1.4 billion people. Roughly 143 crores is the population that India has. And we have close to around 20 lakh mom and pop pharmacies in the country. These are data points. So the other pharmacies that you see, primarily they sell either branded medicines or similar. For Davaindia, and Davaindia is the only pharmacy in India that sells 100% private label. What does it mean? It means that, for example, if a patient, if any one of your home you have cardiac patient or diabetic patient, easily you will see that your bill value will go up to 5,000 to 7,000 rupees easily per month. Now there is, if you get the similar molecules, then your bill value comes to as low as 1,500 rupees. And these medicines are manufactured in the same plants, so are the same manufacturing units. Now there is where you build a niche story unfolding to the end consumer to understand that you cannot extract and keep extracting money out of the consumers. Of course, we have the offline and the online platform where right from the rural to the interiors of India is what we are catering to. Now, the problem is that in India we are speaking so much about retail, but most companies, and especially when I work with the governments, I see most companies don't understand that what the basic need for India is at this point of time. It is to have a healthy India. And if you don't have that healthy India, whatever businesses that you are seeing today, trust in me, it's not too far that those will start evaporating. And I would say 50% or more are all the new businesses that we see and all the new jargons that we hear. That's not what Indian retail is all about. Indian retail is all about, we are sitting in Bengaluru. You just go a little ahead, go to Hoskote, go to Chennapatna, go to Bandia, go to the interiors and see that people cannot afford basic food. What are we talking about retail there? And there is where, if you don't have the basic food, the basic medicines, I find mothers crying because they can't afford branded expensive medicines. Now, I find, see, we have great products, and anyone who have gone to any of our 1,500 stores that we have across the country, they have seen those products. Now, anyone who is a vegetarian, they may be deficit of, say, for example, vitamin B12, methylcobalamin, and you go to a normal clinic or a hospital, easily you spend 300, 400 rupees. An average Indian who earns close to around 15 to 20,000 rupees, what is retailing for them? With 20,000 rupees monthly income of a person, we are talking about retailing, can't imagine. And they would have the expenses of their children going to school. They will have to pay a rent of at least 4,000 to 5,000 rupees. They will have ailing parents. Now, unfortunately, we don't speak these realities. And there is where the Davaindia comes into action. There is where we make people understand, I was speaking about vitamin B12. You spend 300, 400 rupees, come to the Davaindia store, it's 12 rupees a strip, same 1500 mcg. Now, why will you spend that 300 rupees? And why not 12 rupees? Now, that is what makes India different. And that is what we are doing. We are working in the Gram Panchayats, we are working in the villages, we are working with the deprived women to make them understand that it is important for first is India to have proper education and to become healthy. If you don't do these basics, whatever we are speaking maybe because we are sitting here, but the meaning is something different.
Lovely. Thank you so much. This is actually what we wanted to know, that how are you going into Bharat and how are you doing it. So thank you so much for letting us know that. Sanjay, over to you.